Welcome to Thoughtful Thursday, brought to you by General Practice Solutions, where we pause to reflect on the stories shaping primary care and explore what they mean for the people working tirelessly within it. This week, the NHS began its winter vaccination campaign earlier than ever, launching flu and COVID-19 jabs across England in a proactive effort to protect vulnerable groups ahead of the colder months. The decision to start early aims to winter-proof the system, strengthening community resilience, reducing avoidable illness, and easing pressure on frontline services. For the first time, parents in some areas can now access flu vaccines for their 2- and 3-year-olds at local pharmacies, as well as through GP practices. This small but significant change reflects a growing emphasis on convenience, accessibility, and collaboration between general practice, pharmacies, and community providers. At its heart, this story is about prevention, not just of illness, but of overload. Each vaccination delivered early helps reduce the risk of future demand spikes, GP appointments for flu-like symptoms, and admissions to secondary care. By acting before the crisis point, the NHS is taking a more strategic, data-driven approach to managing winter pressures. For those working in general practice, however, it is also a reminder of the balancing act between public health ambition and workforce capacity. Delivering an expanded vaccination program demands careful planning, flexible scheduling, and additional administrative and clinical coordination. Many practices are recruiting temporary staff or adjusting rotas to meet demand without compromising continuity of care. But within this challenge lies opportunity. The early rollout encourages teamwork across sectors, strengthens relationships with local pharmacies and community teams, and reinforces the role of primary care as the cornerstone of prevention. It is also a chance for HR and practice leaders to revisit how they support staff through seasonal pressures, whether through well-being measures, clearer communication, or simply acknowledging the collective effort that makes such programs possible. The success of this campaign will not only be measured in uptake numbers or reduced admissions, but in how well the system works together. It demonstrates that when planning, communication, and collaboration align, the NHS can shift from reaction to prevention, from firefighting to foresight. As we head into winter, let this serve as a timely reflection for us all. Preventive care is not only a clinical concept, it is an organizational one. Protecting our workforce, planning ahead, and acting early are the same principles that sustain both patient health and staff well-being. Thank you for joining us for this week's Thoughtful Thursday, brought to you by General Practice Solutions, supporting the workforce behind primary care.